Welcome to the recorded version of the Grantmakers and Aging web seminar, Crossing the Rubicon, Finding New Roles and Purpose for the Aging Network in the Age of Managed Long-Term Care Services and Supports, featuring Martha Roherty, Executive Director of the National Association of States United for Aging and Disabilities, John Michael Hall, Senior Director of Medicaid Policy and Planning at the National Association of States United for Aging and Disabilities, Callie Peterson, Program Officer with the SCAN Foundation, and John Feather, CEO of Grantmakers and Aging, from July 9th, 2013. This event was made possible by a partnership between Grantmakers and Aging, the John A. Hartford Foundation, and the SCAN Foundation. Technical and production support is provided by the American Society on Aging.
Thanks, Steve, and welcome to everyone to this version of Conversations with GIA. This is part of our continuing series of monthly webinars on critical topics of interest to funders in aging. As Steve told you, today's session is on finding new roles and purpose for the aging network in the age of managed long-term care services and supports. I'm delighted that so many of you have joined us today for this important topic. Before we begin, I want to thank the John A. Hartford Foundation of New York for their continuing support of this series, and the SCAN Foundation of Long Beach, California for their co-sponsorship of today's webinar. I also want to thank our expert team at the American Society on Aging for providing technical and production support for this series. Across the country, the pillars of the traditional aging and disability service network, that is, the area agencies on aging and the centers for independent living, find themselves in the midst of a struggle to define a role for themselves in the world of home and community-based services in the aftermath of states' decision to transition their long-term care systems to managed and integrated care. Responsibility for eligibility determination, functional assessments, service planning, and care management will pass to managed care organizations or other vendors in this model. This extraordinarily rapid shift seems to have caught most of these agencies by surprise, and the potential threat to their continued existence comes not just from the loss of funding, but also from the realization that they will no longer serve as the gateway and center of gravity for aging and disability delivery systems. This webinar will help us define new roles, purpose, and new markets for these vital links in the nation's aging and disability delivery systems, a pathway that can help these community-based agencies inhabit new roles in these emerging systems and serve new audiences, and the expectation that these agencies will need to satisfy in order to perform these functions appropriately and sustainably. We are pleased to have three of our nation's best experts to guide us through this discussion. Martha Roherty is Executive Director of the National Association of States United for Aging and Disabilities, or NASHAWOOD, the national association that represents the nation's 56 state and territorial agencies on aging and disabilities. John Michael Hall is Senior Director of Medicaid Policy and Planning at NASHAWOOD, and Callie Peterson is a Program Officer at the SCAN Foundation. Welcome to you all. As we move to our next slide, Martha, let's start with you. How do you see the state units in aging or disabilities engaging in this new process?
Well, welcome and good afternoon, John, and thank you for allowing Mike and Callie and I to address all of you. Well, over half of the states are in the process of moving to manage long-term services and supports from a fee-for-service Medicaid program, and this migration has created a dramatic and sometimes unsettling change for state aging departments. So at NASHAWOOD, we believe strongly that the state agencies on aging can play a pivotal role in shaping the new system. And one key element that we want to start the conversation off with today is in engaging with stakeholders. So some of the stakeholder groups that the state agencies on aging and disabilities will be working through the process include consumer groups, institutional providers, home and community-based service providers, area agencies on aging, centers for independent living, advocates, managed care organizations, and then, of course, their state legislatures. The agency's role in dealing with these various constituencies can vary, but three key roles include the leadership in promoting and making a strong case for change, communicating that change effectively in a timely fashion, and decision-making.
Why is it essential to engage stakeholders as we move to the next slide?
Well, Mike and I put the slides at the beginning of the presentation because engaging with stakeholders can mean the difference between a successful transition or a failed attempt. So why wouldn't you want to listen to the people who use the system? Why wouldn't a state want to develop buy-in for consumers, from consumers and others who use the system? And even a state that decided not to engage in stakeholders, CMS is going to require the states to do so.
So we move to the next slide. We've been talking about the stakeholders, quote unquote, in this process. Who are they specifically?
Well, the next 3 slides actually chart out who the various stakeholder groups are and what the potential upsides and downsides of dealing with each of the groups can be. For those of you that attended the HCBS conference, I think 2 years ago, Assistant Secretary Greenlee listed off several of the key groups that the states should be engaging with. Navigating throughout the stakeholder waters can be choppy because clearly the needs of some groups conflict with the desires of the other groups. So states have to think really clearly about the messaging they want to deliver to each of the groups.
As we move on to the next one, how are state agencies and advocates involved?
The state agencies on aging can assist, and we would argue are perfectly positioned to help Medicaid agencies who are the primary agency that will be engaged in managed care, engage with the stakeholder groups. They're well positioned to talk to consumer groups, as that's one of their key missions. They have relationships with the institutional providers because of their role as the ombudsman. Through their work in information and assistance, they know who the home and community-based service providers are. They contract, obviously, with the area agencies on aging, et cetera. And so they have various opportunities to continue those relationships and their involvement as the states migrate into managed care.
And if we go to the next slide, are there other important stakeholders?
Clearly, there's a bigger need and role that the state units on aging and disability can get involved in building relationships with managed care and with the accountable care organizations. State agencies on aging were not included in the accountable care portion of the Affordable Care Act, and therefore we didn't see a lot of states moving into that direction as of yet. But there's a new push for states to do that and be engaged, and that's an exciting opportunity.
As we go to the next slide then, how should stakeholders be engaged?
Well, the answer is really simple. Early, often, and continuously throughout the process if a state really wants to be the most successful. The process is not about having a checklist of stakeholders and meeting with them once and then crossing it off the list and saying you've done that. To be successful, engagement has to be done in multiple venues and using every communication channel possible.
And that, as we go to the next slide, how should the agencies engage the stakeholders more specifically?
Well, as we stated earlier, stakeholder engagement involves a careful process of meeting with stakeholders in the most appropriate settings possible to maximize participation and collaboration.
And in the next one, does the type of engagement change over time?
On the slide 9, it outlines like a broad framework of the phases and strategies that a state may choose to employ in order to reach the desired outcomes for each of the phases. A key point in laying out this graphic is to show the stakeholder involvement is deliberate and strategized, and that by having a plan in place, you can develop the trust among the various groups.
I want to remind our audience as we move forward to the next slide that you can get a copy of these slides because there's a lot of information that's really great stuff on here by sending an email to info@asaging.org, info@asaging.org. And also on your screen you will see there's a box for questions. We will be having questions at the end of the session, but you can go ahead and start typing those in now as we move through this. So Martha, back to you. On the next slide, I would suspect that communications is a critical part of this process. What are some of the challenges there?
That's very true, John. We advise states to begin by telling the truth and communicating effectively and often with stakeholders. But it's also important to make sure you're communicating with them in a language that will anticipate what their greatest fears are and fend them off from the beginning. Our member from Virginia once said that the only group that he knows that likes change are wet babies. So communication appropriately is really key and critical to success.
Right. And our next one, and I'm not even so sure about wet babies sometimes, but how do you know if this process has worked?
Well, we're pivoting a little bit in the discussion here, and we're going to begin to talk about our hopes for managed long-term services and supports and why states are going to engage in it, because it's a huge issue for stakeholders who don't like change, and they will want to know that the managed long-term services and supports will improve the outcomes and strengthen the home and community-based service delivery system. So a successful transition will mean ultimately that we'll have improved outcomes clinically, which will reduce costs and improve satisfaction among consumers.
We've heard a lot about home and community-based services over the last few years. What's happening to that system as we move to the next slide?
I think that it's important to discuss that while the change is really radical in the long-term services and supports population, over 70% of the Medicaid population is already being served in managed care. And so what this slide basically shows that while 70% are being served in managed care, only they're accounting for 30% of the spending. So in general, in managed care right now, the healthier moms and kids are covered under managed care, and that's why it accounts for only 30% of the spending.
On the next slide, why do you think this change is happening?
Well, this slide just illustrates the point that I just made, which basically is showing that the elderly and disabled population, the 34% that you see at the bottom of the slide, are accounting for 68, nearly 70% of the Medicaid spending. And that's not surprising. These are the individuals that are the sickest and need the most services. So the states are moving into the managed care for a variety of reasons, but one of them is, to quote a famous bank robber, they're looking to that situation because that's where the money is, and they need to get a handle to bend the cost curve in that area.
And as we move to the next slide, what do you see as the bottom line for aging and disability networks?
It's a highly disruptive and volatile time for the aging and disability networks. I think it's filled with challenges, but it's also filled with enormous opportunities. So in order to become a part of the change, the networks will need to step up their overall quality, their services, their community engagement, their business practices, or as my colleagues have frequently said, if they don't step up, they're likely to get stepped on.
Well, thanks for that probably word of warning, but also encouragement to move forward. As we move to the next slide, I want to bring Mike in at this point, but also I want to remind our audience once again that you can go ahead and enter your questions in the question box you see on your screen. We already have several questions, so looking forward to that part. But Mike, let's talk to you a little bit about the managed long-term care services and support system. How do you see this impacting the work?
Well, you know, we have we've built a system in home and community-based services, mostly under the auspices of the Medicaid waivers for the last 20 or 30 years, where these community-based agencies, the area agencies on aging and the centers for independent living, wore multiple hats. And in many cases, it varies from state to state, but in many cases, they were key players from the moment that somebody first came into the system. They did the assessments on the front end. They provided information referral. They did the service planning. They did case management, and then they were often the service provider. So it was a soup to nuts operation, and that's not how the managed care system is likely to shake out. On this slide, three of those key functions, the front-end assessment, the development of the care plans and then the ongoing day-to-day service coordination and care management are likely to be done by somebody else. And the implication for the community-based agencies is that those three functions by themselves had become a huge part of their business model and the revenue that they were receiving from Medicaid. So that's where the disruption really comes from.
So move to the next slide. What do the state and local agencies need to do now?
Well, I think the first order of business is really to take a hard look at their business model and to start thinking about how they move forward in an environment that is market-based, where they're going to have to compete for business on their merits against other potential vendors, and they're going to be needing to persuade either the state in procurement processes or managed care organizations who are looking for folks to partner with them to deliver services, or even the private market. But in all of those things, performance matters, and getting good outcomes matters, and being tuned to the market matters. So the last bullet on this slide picks up another issue, which is if you're moving to a competitive market-based environment, you also have to know how to price your services. You have to be intimately familiar with what your real costs are so that you don't overprice your services and take yourself out of play. And on the other hand, you don't lowball and underprice and then find that you fail because you can't cover your costs.
As we move to the next one, you've already started talking about some of the challenges, but what are some of the other challenges and implications for the network?
Well, part of it has to do with the supply of community-based agencies that we have, and this is an issue, and both with respect to those agencies and the provider communities throughout Medicaid, the world of Medicaid waivers, whether you're talking about intellectual disabilities or physical disabilities or AAAs. We have, over the course of the past several years, developed a pretty robust infrastructure. And one question is, how many agencies do you really need to provide these services in a managed care environment? And also, who will be able to meet the test that we talked about a moment ago, John? The folks who make the transition to a market-based environment, who are business savvy, who really rethink their business model and their approach are likely to survive. The folks who have a hard time adapting or coming to grips with the fact that the system has changed are going to really struggle.
Well, we've talked a little bit about the challenges. On the next slide, what are some of the opportunities? Well,
there are opportunities both to work in the managed care world and in the world of capitation, and there, as we'll talk about in a moment, opportunities that exist outside of that as well. Managed care organizations that are stepping into the role of doing care coordination and care management for seniors and adults with disabilities and receiving a capitation from the state to do that are going to need to offer a full array of community-based services to individuals to support those individuals to thrive in the community. The community-based agencies like the AAAs and the Centers for Independent Living are very well positioned to be vendors of those services because they've been doing it for a long time, because they know the population, because a word that we use is that they're literate with the unique needs that these populations have. And I'm not sure that managed care organizations are especially interested in having to go out and build up that infrastructure when it's something that can be purchased from the existing players.
On the next slide, what else should they be doing?
Well, I think the other opportunities that exist for them in terms of lines of business, one of them is that gateway process that historically they had been playing, but now it takes on kind of a change. The issue here, though, is that as folks come into the long-term care system, there needs to be an independent, and I emphasize the word independent, assessment of their functional need. What kind of assistance do they need? What kind of services need to be wrapped around their other programs in order to ensure that they are able to live independently and exercise autonomy? one of the long-standing issues in long-term services and supports has been the question of whether the folks who do the front-end assessment also have a stake in delivering services down the road and therefore have the potential for conflict of interest and influencing those decisions. So you see states like Kansas and some others starting to move in the direction of looking to these community-based agencies to be those front-end assessors and paying them to do the functional need assessment that later feeds into the care plans that get developed.
On the next slide, are there other possibilities?
Yep. We see in other states, and I think you're going to see more of this, the question of how do you help consumers, particularly new folks who are coming into the system, but also folks who are transitioning from the existing fee-for-service system to managed care, how do you help them be informed consumers? Because in most states, there are going to be multiple plans to choose from. CMS rules require that beneficiaries, by and large, have a choice of plans. The plans are going to have different benefit packages. They're going to have different providers in their network. They may even have different pharmaceutical coverage. And so the question comes up, how does a beneficiary select the one that's the best fit for them? And a good way of doing that is have a state contracting with somebody to be that independent advisor and help them match up their particular need or who their doctor is with the plan that most closely fits them. Another opportunity is it really moves out of the managed care environment and leverages the experience that these agencies have providing home-delivered meals, providing transportation, doing bookkeeping and bill paying for individuals, a whole range of things that our community-based agencies do today but have been doing largely with government funding and largely for an indigent population, and yet there's a huge market out there for baby boomers who are trying to keep their parents at home who need all that same help and would be willing to pay a high-quality agency to make sure a meal gets to the house every day or help pay the bills when the child lives hundreds of miles away and struggles with those responsibilities. So, John, I guess the only thing I'd say here is that these are both examples of these agencies starting to think in an entrepreneurial way about how they take the experience and the infrastructure they have and put it to new markets.
Well, that's obviously very important in this kind of environment. On the next slide, you've already talked a little bit about Kansas as an example, but how do you see these changes playing out in the different states?
Well, some of it, we're starting to see some states moving in some of the directions we talked about. For instance, having area agencies or CILs work in the role of enrollment broker or doing upfront assessment. In a couple of cases, but I don't know that we can say that this is a trend or going to be widespread. But in Massachusetts and Ohio, the state requires that the managed care organizations work directly with the area agencies on aging to act as the case management entities. So this change is still very much coming into effect. A lot of states have signaled that they're moving in this direction, but haven't yet gone live. So I think it's actually still a fairly fluid environment for both states, our members, to be thinking about roles that these agencies can play, as well as for these agencies positioning themselves to be in one of the roles that we have on these slides.
So certainly one of the challenges is to make sure that agencies are ready to go in whatever environment they're working in. So on our next slide, we know that this is a very complicated topic and that there's many other issues. Are there other important issues that we're not going to be able to get to today, but we also need to be paying attention to?
Well, a lot of our conversation today has revolved around the challenges and opportunities for the local agencies that are down at the county level or in communities. But the The magnitude of this change has profound implications at the state level as well. The states, frankly, are going to have to change their business models as well. When they ran these fee-for-service waivers, they had functions and staff and activities that become superfluous when you contract with managed care organizations to do care management. So they need to step back and think about, okay, as our network is changing, how do we change as well? Where should our staff be? How will our functions need to adapt to the fact that we're now in contract enforcement and quality management business rather than a program administration business? And they may have functions that they don't need anymore. They may have new functions that they need to put in place that they haven't historically staffed. The other part of that also is the reality that states struggle with change just as everybody else does, as you and Martha were talking about earlier on. And this isn't just a question of putting up a new org chart. It's often communicating and leading your own state staff to a different place. Many of those folks have been running the fee-for-service programs for 15, 20, 25 years, and they struggle with the cultural change as well. And I think the last thing is really we could do a whole nother webinar on what is the marketplace telling us about how our services need to change, what do consumers of the future expect in terms of what services look like, what does the array and menu look like, what's the quality look like, and flexibility. A lot of our infrastructure has stayed pretty much unchanged for quite a while, and yet the market, I think, and the messages we get for baby boomers indicate sometimes not very subtly that they're going to be looking for something quite a lot different than what we've been doing in the past.
Well, thanks, Mike. As we turn to the next slide, before we turn to our funders' response, we want to thank Paul Trubin for his help in preparing this presentation. And then on the next slide, there's contact information about Nashua, and be able to provide that to you.
John, can I just note a typo that the acknowledgement slide should have said Paul Saucier at Trubin. I just noticed that yesterday.
All right. Well, I'm sure he acknowledges and is appreciative in any case. And as we move on to the next slide then, Kelly, I want to bring you in to give us a perspective as a funder. And one more slide then. Why is the SCAN Foundation interested in this massive change that we're seeing on the national level?
Thank you so much, John. And again, thank you to everyone who's joined the webinar today. I should say good morning or good afternoon, depending upon where you are located. And really, you know, the SCAN Foundation thinks that this is an incredibly important topic. Our foundation is an independent nonprofit foundation dedicated solely to the topic of long-term services and supports. Our mission is to advance the development of a sustainable continuum of quality care for seniors. And we do that through three funding priorities: public engagement, policy options, and promising programs. Really, public engagement for us is communications wholeheartedly. It's about understanding the terms that people use to describe the phase in their life where they will need services and supports. And if you get into the general public, most people aren't using terms long-term care or even long-term service and support. So really understanding how people are talking about this phase in their life so that we can generate focus on these really important topics, stakeholder engagement being a key component of that work. Policy options are, once we get people talking, what are the tools that need to be created for elected officials and those in a position to make changes such as the programmatic changes that were described in great detail by Martha and Mike. An example of a product that the SCAN Foundation has supported the development of would be the long-term services and support scorecard, which any stakeholder could use to understand how their state compares against other states in particular categories of long-term services and supports. Our third funding priority is promising programs. This is where we look like a traditional foundation. We only do work in California in this area, and it's where we take models that have been proven but want to be expanded to either a new population or a community-based organization that wants to really build their business case for this model. And Mike really touched upon components of building a business case for a model. It's really a skill set that many community-based organizations have not been exposed to, and helping them build out those areas so that they can be more successful in these new models of care. Again, I'd like to note our stakeholder engagement efforts do primarily exist in the first and second funding priorities, but in reality, they are included in nearly every project that we do, because essentially it is a key to success for really any effort in this area.
Well, thanks for that background information about SCAN and its tremendous work. As we move to the next slide, how do you see the structure of the states currently in this particular issue?
Well, this slide really demonstrates the current model that most states have, which is that a state is a direct purchaser of long-term service and supports. And I've given a number of different examples of the types of services that they were purchasing. This model is changing, and the next slide, as you'll note, John, is really where more than half, as Martha noted at the beginning of the webinar, more than half of the states are moving towards.
So as we move on to that one, how do you see that change in the future playing out?
Well, at this point, our understanding is that by 2014, 26 states are scheduled to have these new models of care that coordinate or organize long-term services and supports. And the primary vehicle for this is through managed care organizations. This shift means that a managed care organization and all stakeholders involved will have essentially a new role. And a number of these questions were noted by both Martha and Mike, but we at the SCAN Foundation also feel that 3 important conversations need to take place. And those include, what are the capacities that state staff need to effectively transition to a monitoring and oversight role? And I believe Mike noted accurately that oftentimes I think we forget that the states also need support in these new models and can't be left out of the conversation. The second question is, how do managed care organizations be effective purchasers of long-term service and supports to provide optimal care? And the third and final question, which has really been the primary focus of the webinar to this point, is what are the opportunities that exist for community-based providers to partner with health plans in these new models of care? And all 3 of these questions can be answered through robust stakeholder engagement. And a foundation, and I hope many of the foundations on the call today are starting to understand that they can serve their broader community through supporting these types of interactions. And I can't say this enough, but to really underscore what Martha and Mike have presented to date, the bottom line is that for any of these new models of care to be successful, that stakeholders need to be actively and purposely involved.
As we move to the next slide then, what specifically is the SCAN Foundation supporting in this process? You've already mentioned a couple, but what are some of the other issues?
So this slide really represents 4 different categories of efforts that we've undertaken to engage stakeholders, working with stakeholders for community advocacy, either from a federal, state, or local level, technical assistance to various stakeholders, providing educational opportunities for member associations, or direct publications from the SCAN Foundation. Just as an example, a lot of the work that we have engaged in with Martha and Mike has really been about educational opportunities for different member associations. Their target audience or their membership have really been our AAAs and our Centers for Independent Living, and engaging them and understanding their opportunities, the challenges they face, and providing them with education and information to be successful in these new models. And that's incredibly important. The rest of my presentation is really going to focus on the first bullet, but again, just to underscore, all 4 of these types of efforts can be very successful for any foundation.
Well, as we move to the next slide, what other initiatives are happening at this point?
So this is, and I fully recognize there's a lot of information on this slide. The left side of the screen is a screen grab from our website that highlights an initiative that we call the Community of Constituents Initiative in California. And it helps organizations to leverage their resources, to speak with one voice, and to really move from a reactionary role to a proactive position, which at the end of the day is the real selling point for stakeholder engagement. It's to empower stakeholders to be a part of these really important conversations. And really this entire body of work is to ensure that these important stakeholders who are doing this really incredible work are a part of policy change at either a national, state, or a local level. And I just want to briefly describe the bullets on the right side. So this effort includes a national group called the Friday Morning Collaborative, which is made up of 40 national aging and disability organizations based in Washington, D.C. And this group was incredibly instrumental in the inclusion of long-term service and support provisions within the Affordable Care Act, and today continues to engage their national networks to educate stakeholders on these opportunities with the goal of helping stakeholders or empowering stakeholders to work with their state partners and their health plans or managed care organizations to pursue these opportunities. At the state and local level in California, we fund the Sacramento-based California Collaborative and 12 regional coalitions representing nearly half of the state's counties. The California Collaborative has become the go-to resource for stakeholder engagement for the Coordinated Care Initiative, which in California includes a shift to Medicaid-managed long-term services and supports. And for our regional coalitions, oftentimes I think funders are thinking about the impact they're having with their investments. In the first 12 months of funding 12 regional coalitions, and this was a modest investment, anywhere between $5,000 to $30,000 per coalition. At the end of the 12-month cycle, those 12 coalitions had produced nearly $1.1 million, and that included new and saved dollars for senior services at the local level. In our current grant cycle of, again, 12 regional coalitions, this effort ends in December. In the first 9 months of this 18-month cycle, the coalitions produced 40 or created 40 products. They organized 50 events, and they held over 400 meetings with key local stakeholders in their communities to elevate the topic of long-term services and supports and to work to improve that system and really educate players at a local or regional level to understand the changes that are really coming to the county level. So the takeaway is that a foundation can have an impact through stakeholder engagement. It's a really powerful tool for a foundation, and that can be at a national, state, or a local level.
Well, as we move to our last slide before we move to questions, if people have an interest in this and want to sign up and learn more about the work that's going on, how would they do that?
Well, just go to our website. You can join our e-blast. We pretty much send one out every week with really enriching materials. Every single project we've ever funded is on our website. Again, we do our own publications to help educate the broader communities interested in long-term services and supports. So please see us as a resource. You're always welcome to just give me a call and talk through bodies of work that you're thinking of funding. I'm happy to be a resource or troubleshoot ideas with you. But again, just to end here, John, and I want to thank you for the opportunity to speak from a funder's perspective. That engaging stakeholders, whether that's supporting them coming together and having a meeting and receiving education, incredibly important education that Martha and Mike presented today, is just incredibly powerful and incredibly important. And I encourage all foundations to think through how stakeholder engagement could become a part of your grant making.
Well, thanks to all three of our panelists today. We do have actually a large number of questions, so I want to move to those and ask our panelists to respond. I once again remind everyone that you can type in your questions under the question box that should be on the right hand of your screen, and I will be presenting those to our presenters. So the first one is, we have heard that 5 states have abandoned plans to move to managed care for dual eligibles. Is this successful anywhere yet? How can we be certain that this movement is going to succeed? Martha, you want to start?
I can start with that conversation. I think that there are, it's true that 5 states have not, I wouldn't use the word abandoned, but they have pulled out of the demonstration that was offered under the Affordable Care Act. That doesn't mean necessarily that they're not interested in pursuing the important work of coordinating the care of the dually eligible. I think it was just that the constraints that they were asked to work within under the demonstration, they weren't able to do those, the types of things that they wanted to do they weren't able to do it, and so they just withdrew from it. In a number of instances, they had overlapping projects that the states were working on at the same time, and they didn't feel like they could do an effective job of doing it. Mike, do you want to add anything to that?
I think you're right, Martha. When you look at what was going on in those states, not a small part of their decisions had to do with the calculations around shared savings. How much would the investments they were making on behalf of the in the Medicaid program that was saving Medicare dollars come back to the states, and where those numbers didn't work for the states, sometimes because of their existing cost structures. They had misgivings about moving forward, but a number of states that are in that, that among those 5 have either signaled to the duals office or have said publicly that they intend to move forward with figuring out how to integrate care for duals and in most of those cases implement managed care even outside of the demo and as you say, without having to contend with some of the financial constraints that they would have had if they'd stayed inside.
Well, let's stay with you, Mike, on our next one, because I want to go through these as quickly as we can. This one is specifically about the PACE program, but I think we might also include sort of many of the other waiver programs and other programs that have been out there in the long-term care environment over a number of years. But how does a program like PACE or some other one fit into this new kind of model?
Well, it's a great question, John. PACE obviously was one of the earliest and most demonstrably successful duals programs that operated with a capitated reimbursement environment. And I think when this change first started to take hold 3 years ago, and even when the duals office started to develop the blueprint for the demonstrations, there was really a question of where does PACE fit into the mix? Do they continue to exist and serve a population that benefits from that model, or do they somehow get rendered irrelevant by the contracts that the state would be letting with MCOs? I think that in the intervening time, and New Jersey is an example of this, and there are some others as well, the states have gravitated towards not deconstructing or abandoning the PACE model, but instead including them on the menu that consumers can choose from when they're being transitioned or coming into managed care. So that, for instance, if a state has a front-end enrollment broker and they're having that conversation with consumers about what plan would be the best fit for them, PACE is one of the things one of the options that they get offered.
Thanks. That's a very important issue. And Callie, this is a question for you. At our foundation, staff is struggling with what types of experts we can refer grantees for help adjusting to these new realities of working with the managed care organizations on the business-related aspects of this transition, such as I'm sorry, I skipped ahead here, such as the marketing costs and pricing. Do you have any specific suggestions about resources for foundation staff to help their grantees in this area?
It's a great question, and in fact, we here at the SCAN Foundation are actually working on a tool for community-based organizations to help them think through, how to price their services and then to articulate that effectively as they engage with health plans. We also have an entire body of work right now called the Linkage Lab, which at this point is providing direct technical assistance to a small group of community-based organizations to really build that business acumen. And we're working with two consultants that we feel have been very knowledgeable in this arena, and we hope to expand that work. But it's really an evolving world, and that's a challenge. Is I think there are a limited number of individuals who truly can communicate effectively to community-based organizations to help build that kind of business acumen, if you will. And I'm happy to pass along for the notes of this webinar, the specific names of those consultants and contact information, as well as some other particular resources that we have passed along through the Linkage Lab to a foundation to think through. It's a really long list, so I'm happy to provide that for all of the listeners if that would be helpful, John.
That would be great. We will make sure that that's also available along with the slides at, once again, info@asaging.org. Martha, back to you for the next one. Are housing needs for seniors being addressed at all in the midst of all these changes?
That's a great question. I'm going to jump backwards just a second and add on to what Callie said. I think that one of the real important things that's happening both at the state and local level also is not just learning the business acumen, but it's also a cultural shift that has to take place from going. The organizations are used to having grant dollars feeding their businesses and also the fee-for-service model under Medicaid. And between the two of those, they're not used to really having to generate a marketing plan and go out and sell their business and promote. And there's an awful lot of very well-meaning social worker individuals that aren't used to doing business plans and business development and costing things out. So I think it's a twofold issue that you have to really address as a foundation to give them support for both how do you just do it in a business sense way, and then the second is really changing the culture of the organization in order to do it. On housing and transportation, there's just never enough money and there's never enough opportunity for states to do more for seniors and people with disabilities on those two issues. There are small pockets of money coming from CMS to develop new supported housing opportunities. There are small demonstration opportunities to do more things to support people staying in their homes and communities. We'll be interested to see the CMS new the final reg on home and community-based setting and what that means, and whether or not there'll be additional opportunities in that reg. But again, it's a very limited, because of what CMS allows states to pay for with Medicaid dollars, it's a very limited amount of opportunity there. And of course, there's very little funding from HUD that goes into senior housing too.
A very difficult area, as you say. And Mike, let me ask you this question. Does the advocacy and coordination role of the area agencies on aging or the Centers for Independent Living change when they become a competitor in this new marketplace with the other CBOs?
Well, I think it does in some ways. I think that they certainly have an ongoing role in advocating for seniors and for programs that focus on high quality and getting good outcomes and being respectful of the wishes of the users of the system, but to the extent that they themselves are also potential vendors in the system, they have to be very conscious about figuring out where their role as a part of the delivery system where it starts to bump up against their advocacy roles.
Kelly, I'll turn to you for this next one, although I think everybody else might have a point of view as well. Do you see best practices for educating the ultimate beneficiaries, the low-income seniors? We've tended to focus on making sure we reach out to the agencies involved in the provision of service, but obviously the seniors themselves are a critical component in this.
So in one of my earlier, the slide that focused on the community of constituents, there was a final bullet point called Agents for Change. We at the SCAN Foundation think that it's incredibly important to ensure that older adults and persons with disabilities and really any community that is accessing the system of long-term service and supports, that they can speak on their behalf and not be required to go through an organization. So we have a whole body of work where we have provided training and technical assistance to individuals so that they could be a part of policy discussions that really affect programs that they rely on and care about. So I think for a foundation to think through bodies of work where they can work with either through their own staff members' expertise or work with technical advisors who are engaged in providing education and training to consumers to have an effective voice in these important conversations, I think is a valuable exercise. I would also note that having conversations with key partners, whether that be health plans, the state, or community-based organizations that are involved in these new models of care, to understand how they're engaging consumers and how a foundation can play a role. Right now, we are working with our 12 regional coalitions that are made up of primarily community-based organizations that already work with many of the duals here in California to develop educational materials and informational materials from their perspective that they think would help consumers to understand these really significant changes that are fast approaching. We'll start no earlier than January 1st, 2014 here in California. And a key component of that exercise that we underscored in the process was to ensure that actual consumers are helping in the development of these materials and that it really makes sense to them. So any way a funder can encourage, either in your grant-making processes or with the grantees you work with, to engage consumers in these discussions is an incredibly beneficial exercise. But to really just make sure you're having robust conversations and understand the full body of work that are engaging consumers so that you're not reinventing the wheel or overlapping, but that you're working together. I think this isn't a best practice, but it's a red flag for any foundation is when there are lots of cooks in the kitchen, the message can get distorted and can really just confuse people. So if you can round up everybody that's going to be involved and just have a simple conversation about who's doing what and how you can be a supporter to have clearer communication and really align that communication for the consumers, you can be, again, just much more impactful.
Martha or Mike, anything to add on working directly with consumers?
I think what I would say, John, is that one of the challenges that states encounter as they move through this change is that historically many of the community-based agencies, like the AAAs and the Centers for Independent Living, started out as advocacy organizations with a clearly articulated mission under federal law to do lobbying and public advocacy on behalf of consumers, but along the way, their business models and their revenue changed, and they became pretty large vendors for state Medicaid agencies. When that kind of transformation of your revenue and your organization happens, it starts to get more and more difficult to separate the interests of consumers from the interests of the organization itself. And so as states move in this direction and do the important work of stakeholder engagement that both Martha talked about and that Callie has talked about, one of the things that is really important is that states try and figure out how they're hearing the direct, unadulterated voice of consumers as opposed to, as Callie said a few moments ago, folks who indicate that they're speaking on behalf of consumers but may not share the same interests.
A very important message. As we come to the end of our hour, I want to ask each of our panelists to tell us their final words of wisdom about this very important and very dramatic shift that we're seeing in the services and the system that we're using to provide services for older people and persons with disabilities. Martha, let's start with you. What are your final words to our audience today?
I think that I would really hope that people would look at this as an opportunity and not as much as a threat. It is a very disruptive time for, as Mike pointed out, our membership and the agencies that they work with. But it also is an opportunity, I think, for the state agencies on aging and disability to really highlight some of the key things that they've long been in the shadow, but are very good at doing. So I think that it's a really challenging time and not one to go running away from, but running into, I think, would be great.
Mike?
Well, I think I share Martha's view, and I also I was just writing something this morning for a different audience, and one of the things that I included in there was the reality that our systems have been pretty disintegrated over the years. The services we provide in home and community-based services have not been well connected to primary care. We haven't done a particularly good job of managing chronic disease for these populations, and the costs, the human and the economic costs of that disintegration are pretty obvious. So one of the biggest opportunities in moving towards a outcome-based, performance-based system is that we improve the quality of life and the quality of care and raise the water level generally for the folks who rely on us in these programs. And I think from the standpoint of community-based agencies who try to, as you say, find a pathway in this new world, it's really thinking about how do they bring something that adds value to that, whether they're working with a managed care organization or they're fulfilling a role for a state. How do they augment and support a system that focuses on measuring and obtaining and rewarding getting the best possible outcomes for people?
Callie?
So I think in closing, I would just really recommend to any foundation that, I am so, I'm often surprised that there isn't a broader understanding of really just how challenging this work is for the individuals that are charged with implementing these changes. We have done a lot of engagement with state staff, as well as community-based organizations, consumers, and health plans to really think through these new models. But what I hear in all of those meetings or provisions of technical assistance is that most of these individuals feel as if they're alone, and that the people they work with don't really understand what it is they're doing. And that's not a surprise. It's really complicated work. And the relief that they feel is visceral and visual to everyone in the room when they realize they're not alone, and that there are others having similar experiences that they can then draw upon for, as some of the questions have come through, for best practices, to understand how to overcome challenges, how to sidestep those challenges. So I'd really just, in parting, recommend to any foundation that bringing your stakeholders together, even for something as simple as a conversation, can be incredibly impactful to the work that they're doing, which at the end of the day really affects some of the most vulnerable in our society. And it's just really powerful work and is very easy to do. And I would encourage you to think through that in your bodies of work.
Well, I want to thank Martha Roherty, the Executive Director of the National Association of States United for Aging and Disabilities, John Michael, or Mike Hall, Senior Director of Medicaid and Policy Services at Nashwood, and Kelly Peterson, Program Officer at the SCAN Foundation, for their insights and expertise. Thank you all for everything you're doing to make life better for America's older adults. I also want to thank the John A. Hartford Foundation and the SCAN Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. And finally, I want to thank all of you for participating in today's webinar. Have a great day.